And you're very welcome back to the programme. We are in the company of Gabriel McSharry, medical herbalist and nutritionist. And if you have questions, send them in to us now to 083 3500 530, which is our text. And you can call us at 0818 365 500. Questions already in for you, Gabriel. And the first one is about Epsom salts. How much do you need to put into your bath if you're someone that suffers from with your bones, pains in your bones and that?
Yeah, so the dosage is, and it's rough, but it's 3 cups per bathtub.
So it's 3 full cups?
Yeah.
Oh.
But you know a metric cup now when you bake? It's different than a mug.
Than a big mug,
you know,
exactly.
Mug could be nearly,
like the mug that's sitting beside you at the minute.
A mug could be nearly 3 cups these days, you know, but a cup in its true metric sense of a cup. So 3 of those. Epsom salt is relatively cheap now, you know. It's just magnesium stearate, and but the way to do it is do it in a basin. With hot water or boiling water, dissolve it there and then add it to the bath, because if you pour it into the bath sometimes it doesn't dissolve right, you know, because you have to swish it around a bit. So and that's it. I mean, you can do it at a lower scale. You can do a compress, which is an old way of also using herbal medicines, but a compress is basically add 1 or 1.5 cups to a basin of boiling water, we'll say, and you can soak a towel in it and let it cool down to a temperature that you can apply to the skin, and then just wrap it around, say, a knee. Or a joint or a muscular system that's aching you, and that's a compress, and leave it there until it kind of goes cold and uncomfortable, and you just take it off.
Are the Epsom salts, is that an old cure? Like, is that something that maybe they would have done years ago? Is it?
Yeah, yes, it is. It's an old one, and you know, with old ones too, just to say that a lot of people think they're gone out with the ass and cart, but that's not true at all. You know, it's just. We've with technology, we've come out with more weird and wonderful ways of applying things, like in a gel, you know, instead of, say, the traditional, as I say, for herbal medicine might be a compress. So if you had a sore knee, we'll say, or a sore muscle, what you do is you'd put certain herbs or Epsom salts or herbal oils into hot water, and you'd soak a towel or a rag in it and then you'd wrap it around the knee. And that's a compress. But if you prescribe that to someone today, it's like, oh, the hassle of that, and it's messy, you know, because you put it on and it's going to be dripping all over the place and stuff. So obviously if you had it in a gel or a cream form, that's a lot better and stuff like that. But you know, you don't see Epsom salts gel really well. I've never seen it, and maybe there somewhere, but so it is a very old one, but still quite powerful. It's something that's safe too, you know. Yeah.
This listener says that about 2 weeks ago she got severe cramps inside her leg, and she says that it's known as footballer's cramps, and she's terrified she'd get it again. Is that something, maybe if it was that severe, that she should go to her GP and just get it checked out to make sure there's nothing underlying there?
Yeah, well, I guess so, yeah. Definitely if it just came on all of a sudden and it was very, very severe. But generally it's due to an imbalance of electrolytes, you know, cramps. And so was she in the sauna or steam room and she hadn't been in a long time? Did she lose a lot of sweat? Is she deficient in salt and other electrolytes? You know, if it came on just out of the blue, something severe like that, then definitely a consultation with a GP or health profession would definitely be advisable. But if it was just something that she gets on and off in bed, or every now and again they're just getting worse, more likely to be a mineral imbalance of electrolytes.
Okay. St. John's wort, is that what it's called? One listener wondering, is it dangerous? Was there some report years ago that something about it?
It's a big issue. It's I mean, the short answer is no. But with anything, it is a medicine. It has the power to heal. But if it has the power to heal, it has the power to harm. You know, it's a rule of thumb herbalists have. But so in certain quantities, in certain contexts, yes, I would say it is dangerous. But in general, if used right, in the correct dose, correct preparation, and in the right context, so where there's not any medication that interact with, it's a very, very safe and effective herb. used traditionally for anxiety and insomnia and the menopause. So this was the three things it's used for hundreds of years for. Depression was something it's heavily studied for in the last 30-40 years, and clinically proven to be very effective for mild to moderate depression, as equally effective as Prozac, which at the time was the most prescribed antidepressant. So is it effective? Very much so, as effective as the most prescribed antidepressant drug. It comprises of 25% of all prescriptions written for depression in Germany by medical doctors. So in Germany it's a little bit different in that medical doctors in college study herbal medicine to an in-depth degree and tend to prescribe it more. However, the law is different where you need to be a medical doctor to prescribe herbal medicines internally. So that's where it'd be different from Ireland and the UK. But 25% of all prescriptions, and that was 1998. So I just show you how powerful it is, how prevalent it is.
So you really
down
need
down to the bones of her question, I guess, is why is it banned from over-the-counter sale in the Republic of Ireland? And that would give the impression that it's a very dangerous thing. But when you look into it, it's not so. So here it is, without I guess getting too complex. St. John's wort interacts with a small class of pharmaceutical drugs. So if taken along with them small class of pharmaceutical drugs, then these drugs may lose their efficacy, or their half-life will be reduced. So it's like taking maybe a reduced dose of the drug. Now, where that gets dangerous is that if someone's taking, say, immunosuppressives for, we'll say, a donor organ, if they had a kidney transplant, if you have someone else's kidney, for the rest of your life you'll have to suppress your immune system, so your immune system doesn't attack this foreign organ. And that's just the way it is. But if you take something that reduces the potency of your immunosuppressive drugs, then that could be dangerous in that your body could reject the organ. So, in context, that'd be dangerous. However, it's legal over the counter in Australia. I was trained and practiced there for many years, and there's very, very little, if any, documented interactions, because it's written on the label, this, if on medication, do not take this.
So just tell you whoever you're getting off that you're on medication, if you're on it or whatever you
definitely,
need to get
I mean, in Ireland, the law is, at the minute, me as a medical herbalist can prescribe it, GPs can prescribe it, and as I say, so long as I ensure that the person isn't on that small class of pharmaceutical drugs, is very, very safe and effective. All
right, is it the leaf or the flower you use of St. John's wort? Ask this question.
Yeah, it's good. It's the aerial parts, so it's above ground. So the stem and flowers. The flowers sometimes are used in an oil infusion, so it's not just used internally for a nervous system tonic, an antidepressant, insomnia and anxiety and so on. It can also be used topically for cold sores and viral infections, so scarring. So how you make that oil externally is we just use the flowers, and you'd put it in a carrier oil, and you can actually do it yourself. I mean, it'll come on now during the summer, St. John's wort, and you put a quantity of flowers in a carrier oil and leave it on the windowsill for 2 weeks and let the sun get at it, and you'll see after 2 weeks it'll have this really deep blood red colour, beautiful red colour, and it's very beneficial then topically.
Okay, nasal polyps, what could you suggest? Already operated on twice before and they are back again.
Yeah, it's a difficult one in that there's no kind of quick treatment protocol.
Quick fix.
Once the polyps form, generally surgical intervention then is needed to get rid of them. However, they can shrink themselves over many years, and how you do that would just be a general approach to health, in my opinion, but also I guess so if one has sinusitis, and more than likely have, nasal polyps probably developed after many years of sinusitis, and so it'd be the focus of treatment in the sinusitis. Also, digestive system, I know it seems unrelated to the nasal area and the sinus, but it's always an area clinically I see that when you treat, the sinusitis improves. But nasal lavage, so with a saline solution, you can irrigate the nasal passage, and this gets rid of a lot of gunk, and the gunk could contain pollens and stuff that cause inflammation that would exacerbate the polyps, make them sore, and so on. But definitely people with polyps, and sometimes they lose their sense of smell, but it can come back after 6-12 months of cleaning up their diet and lifestyle and certain herbal medicines.
Okay, this listener says their eyes are very blurry. Anything they can take or do? I presume that's one for the optician, is it? Blurry eyes?
You definitely need to work out why they're very blurry. Is there something in there, a foreign body? Are you using them a lot? So sometimes like if your eyes go blurry, it doesn't necessarily mean you need glasses and so on if it just comes on, because it can go away again. But ruling out anything dangerous, so a foreign body in it, an infection, and so on, if they just come on. Have you been studying for exams? Have you been doing a lot of work overtime, maybe on a computer, looking at a screen a lot, or maybe doing a lot of research or something? That generally can fatigue the muscles in your eyes. That can, it's the muscles that hold the lens, and if they're fatigued and constrict, they can lead to blurriness. And it could be that. Now, other than that, then I'd probably get them checked out, just to see. Checked out.
Listener has bad arthritis, 3 course of injections taken, had scans, the lot, and it's not getting better. Is there anything that you can recommend?
It's hard to know which arthritis. I guess if they were given injections, maybe steroid injections, is probably rheumatoid. Rheumatoid meaning an inflammatory arthritis, a bit different than osteoarthritis. Both have a degenerative effect on the joints, however. But with rheumatoid arthritis, there's a number of ways. Like herbally, we use immunomodulators, so it's an autoimmune condition. Your immune system is attacking the joints, and also anti-inflammatories. Vitamin D is very important, so counselling around that, foods that contain it, maybe supplementation, and obviously there's some dietary things you can add to diet. These can all be taken in supplemental form, but I like to emphasize the dietary form. And some of the most powerful ones for arthritis, be it osteorheumatoid, are thus curcumin. It's an extract of turmeric, which is the yellow herb or spice that's added to curries in India, but it's used now widely in cooking in Ireland and the West today, because it is a very, very strong, potent anti-inflammatory, and it's high in antioxidants. This is a great thing that, many years ago I've added to my little kind of spice rack, and I just give a sprinkle over a meal as much as I can, and it's a very beneficial herb. Ginger or zingiber, another great herb, again can be added to food. I add the fresh root. All these again can be taken in capsules and supplements and that, but in general, if you can add them all to your diet and take a small amount for many, many years, the anti-inflammatory effects, antioxidant effects are very beneficial. One more thing is boswellia. Boswellia is well researched anti-inflammatory, and has beneficial effects in arthritis and autoimmune conditions. Boswellia is also known as frankincense, so it's one of the things that that's in the Bible, gold, frankincense and myrrh. Well, frankincense and myrrh, another herb, are both strong anti-inflammatories.
Okay.
And gold, funny enough, is used in rheumatoid arthritis as well. Yeah. In the pharmaceutical realm, I know it sounds a bit strange, but gold can be taken as
kind of gold injections or something, is it? Or
you can, yeah. And they were looking at the pharaohs in Egypt, which by studying their bones, they had arthritis too, but they were drenched in gold, a lot of these guys, and they did like a bit of bling, but also it may have a beneficial effect on inflammation in the body.
Okay, and just finally, got cataract done in my eye 10 weeks ago. Since that, the eye is running with water, and doctor says there isn't really anything wrong. Any advice?
Yeah, it's a hard one when there was surgery done, but there's, for cataracts or any kind of eye condition, there's a number of what I suppose nutraceuticals, so nutrients that are of benefit. Herbs too, but the herbs contain the nutrients, and they're antioxidants. Lutein and zeaxanthin are the two most beneficial, and you'll get these in yellow, green, purple pigments. And so where are they in nature? The yellow is in turmeric. I mentioned that herb is quite strong in them, but also the yolks of eggs. Greens, obviously your green leafy vegetables, you're getting lutein, zeaxanthin, and the purples are blueberries, plums, red grapes. The pigment in them skin are quite high in lutein, zeaxanthin. So obviously add all these to your diet. I also give herbs like bilberry and vaccinium that are very, very high in these, they're polyphenols, procyanidins, and all very beneficial for eye health in general, and definitely that'd be a recommendation.
And when we were growing up, the carrots, we're told the carrots
definitely, yeah, again,
plenty of carrots.
The pigmentation, but also I guess carrots was more so the beta carotene that converts to vitamin A in the body, which is beneficial for eyesight. But what I just mentioned there was based on the antioxidants, zeaxanthin and lutein, which are in carrots too.
Okay, Gabriel McSharry, medical herbalist and nutritionist, thanks a million for joining us on the programme. We're back after the short break.
Ocean